Chronic obstructive pulmonary disease, often known as COPD, accounts for about 3 million deaths every year, making it the third leading cause of death worldwide. Yet, many people don't even know they have it, until breathing feels like dragging air through a clogged straw. That's the hidden weight of COPD. In this video, I'll strip down COPD down to its essentials, what it really is, how it develops, the signs and symptoms you should never ignore, and how it could be managed. And by the end, you'll understand not just the disease, but the patients living with it. Think of it as a long-term damage to the lungs that makes airflow limited and permanent. It's not asthma that comes and goes. And it's not just chronic bronchitis. It's a mixture of problems that scar the lungs and narrows the airway. The main cause? Smoking. It accounts for up to 90% of cases in some countries. But the story doesn't end there. People exposed to biomass fuel, like wood smoke used for cooking, are also at risk. And in some cases, genetic plays a role, such as in the alpha-1 antitrypsin deficiency, where the lungs lack a key protective shield. Over time, this irritant causes chronic inflammation that leads to the destruction of the walls of the tiny hair sacs and clogs the pipes with mucus. Eventually, this results in hair getting trapped and oxygen exchange failure. There are two main processes that drive COPD: chronic bronchitis and emphysema. I explained bronchitis and emphysema in earlier videos. You can find them on my channel for extra context. Put together, these processes causes the lungs to trap air, inflate too much, and leave the patient gasping for breath. The classical triad in COPD is chronic cough, phlegm production, and breathlessness that slowly worsens. Over time, patient may develop a barrel-shaped chest, progressive wheezing, and use of accessory muscles, which eventually leads to fatigue. And in advanced stages, patients report weight loss and bluish lips or fingers. The gold standard test for diagnosing COPD is a breathing test called spirometry. If the FEV1-FVC ratio is less than 0.7 after using a bronchodilator, COPD is confirmed. In simple terms, it means the lungs can't blow out air fast enough. Imaging like chest X-ray or CT scans may show overinflated lungs or flattened diaphragms. Also, blood gases helps in advanced cases. The main differential diagnosis of COPD is asthma. Both causes obstruction, but here is the key difference. For asthma, there is a reversible obstruction which improves after using bronchodilator. However, with COPD, there's an irreversible obstruction. Now, let's talk management. The first and most effective treatment of COPD is smoke cessation. No drug beats quitting. Then, inhalers come in handy. The short and long-acting bronchodilators. Also, inhaled corticosteroids if flare-ups keep happening. Next is pulmonary rehabilitation. In addition to this, vaccination against flu and pneumonia. And for patients with low oxygen level, appropriate oxygenation is recommended. For advanced cases, surgery or even lung transplantation might be considered. To remember this very swiftly, especially for students who love mnemonics. Think slow the damage. Stop smoking, LABA or Laman inhalers, oxygen if needed, walk, exercise with rehab. Also, remember, COPD doesn't like to suffer alone. It brings company. Complications like frequent infections, respiratory failure, pneumothorax, and pulmonary, which is a strain on the right side of the heart. So, here is the takeaway. COPD is common, deadly, and often preventable. If you see a smoker with chronic cough and breathlessness, think COPD early. With the right interventions, patients can still live longer, better lives. Thanks for watching. If you found this helpful, don't forget to like, subscribe, and share this video. Knowledge is power, especially when it comes to breathing. See you on the next one. Bye for now.